Hello, everyone. Welcome to Tech Talk with Next Realm AI. I'm your host, Tom Bustamante. Join me as we explore some of the newest technologies and investment opportunities of tomorrow. Sit back, subscribe, and let the journey begin. Good day, everyone. Welcome to Next Realm AI's TED Talk. I'm your host, Tom Bustamante, and today we're speaking with Janice Wanchalewski. She's the Chief Commercial Sales and Marketing Officer at HandsFree Health, and Patrick Batania, who is the CEO of MetAlert, which is traded under the symbol MLRT. Welcome to the program, guys.
Thanks for having us.
Sure.
Thanks for having us.
Yes. So, Janice, I would like to start with you. Just to catch up, HandsFree Health is an interesting SaaS software as a service company focused on customer solutions for the healthcare industry. Your flagship product, Wellbe, is a voice-enabled virtual health assistant platform, which I found really interesting. So to start off, could you tell us a bit about HandsFree Health and how does your virtual health assistant improve the user experience and make interacting with Wellbe more natural and conversational?
Yeah, it's a great question. So as you said, Wellbe is a voice-enabled virtual assistant. Something that's very unique about us is that it's powered by a comprehensive HIPAA-compliant digital health technology. So it's very safe and secure. Our background has really been in healthcare, and when we talk more about our product, it's really basically there to help people better manage their health. So it's there for businesses, for seniors, for caregivers, for families, and it can be on different devices. So you could use the HFH Go mobile app that we'll be partnering with Patrick on. We also have a Wellbe smart speaker, which is going to be similar to other devices that you would see in people's homes, but ours is HIPAA compliant. So people don't need to be worried about recording of conversations and things of that nature. And we also have a smartwatch and a smart pendant, which are both wearables that are there for emergency situations, so that if somebody were to fall or need help, there's two-way talk. But what we think is very unique about them is that they both also act as virtual assistants. So you could ask your watch, what are my reminders? You could ask it, questions on your healthcare. What's the symptoms of a certain disease, or something that typically people use virtual assistants for, trying to find where the nearest Italian restaurant is. So it's very versatile, but we're seeing that people are engaging with our devices on a daily basis, and that 50% of the time they're using it for health information. So, we are a technology company, but something that is definitely unique about us is that our, founders really are health executives, collective experience and expertise. They created this platform. So our CEO, Mike Cardillo, is a former president of Aetna, and our president, Dan Messina, is a former CFO of Aetna. So they bring a lot of knowledge, and their goal in starting this company was really to help people, because healthcare is complicated. I guess the last thing I would mention, Tom, because you brought about the conversational aspect of it, sure. And we just launched an optional feature a couple of months ago called Wellbe Chat. So it's really a chat GPT form of AI, and we work with Microsoft as we do with most of our products. So we are part of the Microsoft startup program, but it's basically it's a digital voice platform to the next level, really, becoming very conversational, and it's really there to help from a loneliness and isolation standpoint. So during the whole conversation somebody could have with Wellbe, it's basically she'll remember what you've said throughout the whole conversation. Somebody, a senior could be speaking about something for, a good half an hour, and she will keep up with the conversation, ask questions. So definitely very, very unique. And we're excited about being, launching this out. And it's also HIPAA compliant as well. The part about Microsoft that I think is important is that it's really there to also protect from any misuse or questionable content. They're going to filter that out.
Yeah, and the whole generative AI, I mean, let's make no mistake. I mean, it's really kind of changes so rapidly. Sometimes you wonder, like, where is this going? One of the first things I thought about, the way that it can interact with the individual, that, on a therapy basis. Obviously, you don't want to have it replacing true professionals in psychotherapy, things like that, but it could be kind of a private assistant, kind of saying, how are you doing today? Are you okay? And kind of build data and kind of, find out a little more about who you are as a patient that could be useful for, I guess, for providers. And that kind of goes to my next question was, what types of feedback or insight can WellBe AI assisted provide to healthcare organizations, to help them improve their patient experience?
Yep. So, we definitely are able to do it in a number of different ways. As I mentioned before, from a wearables, from the watch or the pendant, that they'll definitely see that from health plans, they're looking at that for some of their folks that have chronic diseases and to be able to really help with the remote patient monitoring. But for Medicare Advantage plans specifically, their star rating system is very important, the way the rankings are, the different products and plans, as well as the financial rewards that a health plan will get by receiving, better ratings. So the star rating system really supports CMS's efforts to empower people to be able to make better healthcare decisions. And so from HandsFree Health, our platform, we see that we're able to help with 16 different engagement pieces through the star ratings, as well as our HFH Go digital tool is able to help with the risk adjustment for new members. So for health plans, it's difficult for them when they bring on a new member to, it takes them a little while to identify those that have, comorbidity. So by using our app, you can actually get that, when they put that in on day one. So really being able to help that whole intake process and involve whether it be a caregiver or a case manager when needed. So that whole financial impact being very important, to the health plan for star rating, but also be able to have a member be compliant for a particular, disease is going to save the health plan, thousands of dollars yearly.
Oh, yeah, absolutely. That's how it kind of works for like the business side, like the provider side, the insurance side, and the organization side. What I always got was just offhand. I could see WellBe also being useful in helping, customize or personalize care between patient and provider. Is that one area you see AI being useful in regards to patient health services going forward?
Yes, definitely. So, our devices really promote and try to help people improve their health and the quality of life of the user. So the smart technology includes everything from, prescription reminders, a doctor's appointment reminders, medical reminders, health information that they can ask questions about, tracking their vitals. And this all can be voice prompted. So it can also be customized where if someone was working with us and they wanted to send notification to particular members that, that have a particular illness or remind them of certain things, they could do that through our devices. But also one of the things I think is unique is that we do have the ability to integrate with medical devices as well as home devices, but we can integrate with over 400 different brands. So if a provider is working with, they want to use a specific blood pressure cuff or scales or glucometers, to be able to upload that information, to be able to see their patients' readings throughout the day. And that's also something that a caregiver, a son or daughter or family member could also see by looking in the app what those readings are throughout the day. So yeah, that's definitely something that's kind of, real time without, having to ask the patient. They can automatically see, what those, readings are.
Is this all done? So I guess you guys have the ability to kind of integrate using APIs, I guess,
Yes,
feed
yep.
data. So that allows you kind of the WellBe plat. It's not just a one-shot product. It's kind of a platform. So I guess you're looking to bring on other wearables and other devices into it.
And that exactly. And that's really something that, our roadmap is continually on, on the healthcare, building out on that to make it more and more, robust. But yeah, that's something that's, definitely something that providers have asked about, to be able to, be able to connect with us so that they, have, real-time data.
Yeah.
But we're really also very excited about, working with MetAlert with our HFH Go mobile app, because this is, they're really wanting to launch this to be able to, work with the telemedicine piece of it will be from Walmart Health Virtual Urgent Care. And then they'll be using our app to be able to get all the health data and health reminders and things of that nature for their clients. So we're really excited to be working with Patrick going forward.
Yeah. And actually that brings us, perfect segue to, our other guests. We're also happy to have Patrick Bertagna. He's the CEO of MetAlert on the program, which recently announced a deal with HandsFree Health for their Go Digital Health tools. Patrick, the new saying these days is data is the new oil, meaning without data, AI just doesn't work. So I was curious, is utilizing AI in patient health data an area MetAlert may become more focused on going forward? And how do you see health data and AI fitting into your business model now?
Well, two great questions, Tom. And so let me start by saying, segueing from what Janice just said, and that is, we really believe strongly in this relationship for numerous reasons. We see the ability of this platform integrating into our wearables. As you know, we've been pioneering wearables for decades. And the wearable industry, when we first started, wasn't even considered an industry. And now I just read recently it's projected to hit $62 billion by 2025. So very exciting to be at the vanguard of this growing industry. And so wearable tech is really key because, like you said, it's about AI which is the hottest thing right now. AI requires data, and where do you get that data from? Well, you get that data from wearables attached to people that are basically just existing. They're going through their lives, and by having wearable devices on them and not intruding in their life, not telling them you have to go to the doctor every month to get a test or to get a shot or to get weighed or to get your blood pressure taken, but being able to attach very low profile, very seamless devices on them and having all that data feed into platforms such as the one that such as our platform and the digital health platform, with Wellbeing free. So being able to take that data and collect it in real time without really interfering with the patient's lifestyle is going to have tremendous value in the future. And so we have customers all over the world, and they use our wearable technology and they're collecting this data. And what I'll get into the second part of your question in terms of the future, but I'll finish this part off is, how we see this relationship with HandsFree is that it just augments our ability to have more subscribers, provide better health assistance, a higher quality of life, aiming for what we call the longevity revolution. So having people live plus 100 years, 110, 120 years, but with a good quality of life. And we see this synergistic relationship really adding and augmenting to that vision.
Yeah. And so it's just this, because it's kind of funny. I tell people all the time, you see so many of these AI companies, it's an explosion now, and raising tens of millions and all. And I keep telling people, as I get, there's a lot of great AI companies, don't get me wrong, but they need the data. It's the guys that create the data. So it's going to be companies that, whether it's, IoT companies, wearable, or, whatever it may be, you need the data and growing data. You need data that's constantly added to build trends and data analytics. So you can have all the great AI companies you want, but without good data, what does it matter? So, it's companies like what you guys are doing, are generating data is what's really key, from an investment standpoint.
Well, let me jump into that because I think, I believe, and you said it, you summed it up pretty well. But the key really is collecting data and being able to augment that data with other data sets. There's only so much data we can collect. We meaning the collective we that makes wearable devices and puts them on their patients. Whether the patient is calling in through an app to get, through the Wellbe app and getting some medical assistance, or whether it's wearing one of our devices, like our GPS Smart Soles, or Janice's smartwatch. All of that is important, and that's the foundation. But like any recipe, you need multiple ingredients. So what we years ago we filed for a patent where we augment data, and what we mean by that is, all right, so here you have Mrs. Smith, who's 82 years old, and she's got some wearables, and we're collecting all that data. great. But you also need to know what time of the day it is, what time of the season it is. Is it
Sure.
night? Is it night or day? Is it fall or spring? Does this person live in the Northeast or the Southwest? Has it been raining lately? Has it been very hot and windy? And so when you take other data sets, which are typically available through the public domain,
Yeah.
and then you combine it with the individuals that are wearing these wearables, and then, like you said, data is the new oil. You've put that through an AI engine. The possibilities, I believe, are going to be phenomenal. And we believe at MetAlert that if we have enough data, which we've been aggregating for years now, and we're accelerating that aggregation of data, of course, being HIPAA compliant, of course, keeping everybody's
Sure.
security. We're not in privacy. We're not talking about telling someone Mrs. Smith's actions every day, or her blood pressure, her weight, or anything like that. But collecting all that data in the aggregate and then being able to come up with predictives, we believe that's the future of medical care.
Yeah, and actually, I think the data science they call like the primary data. That you use that data to trade off other publicly available data sets, and then that's how you train your data. But that's very key to have that primary data. That's unique and stuff like that. So it's pretty awesome what's really going on. So I know I want to really get it before we wrap it up. You recently announced a deal with HandsFree Health, and I was wondering if this is the type of partnerships we could look forward with the company, and you go with MetAlert going forward, and how does HandsFree as a partner help you going forward?
Yeah, great question. So yes, we expect to be we're in constant conversations with other potential partners, and we're about to sign a couple of other agreements, and we'll be making those announcements shortly. So that is a big piece of our roadmap, is to align ourselves with other partners that either have other wearable devices or that are in the AI space, and that can help us build an AI engine that will take all this data and lead it to the predictive analytics that we're looking for. So we absolutely have a lot of partnerships in mind. We want to expand our partnership with HandsFree, and talk to them about potentially bringing their watch on, and melding their watch with our smart soles, and potentially some of our other devices like Roommate, which is a 3D infrared home solution that monitors fall and gives patients some kind of assistance when they're not feeling well. And then it's all done autonomously there's no cameras or anything like that, but it's all 3D infrared technology, very cool stuff. But yeah, the short answer is we're absolutely looking to make new partnerships. Our goal is to try to have as many devices out there feeding the $62 billion wearable beast, and then collecting as much data as possible. We're based in Los Angeles, so Hollywood, California. There's been an old saying here for years. It says, content is king, but distribution is King Kong. And I see it the same way. AI is the new king, but the data is going to be the King Kong. You need
Absolutely.
that oil to fuel those engines,
Yeah.
And then the possibilities will be endless.
Yeah, absolutely. It's been, when it comes to one of my favorite areas I really focus here next realm, when it comes to AI, is definitely AI in healthcare. I mean, I think we haven't even uncovered a sample of what is potentially about to come. So it's like we're just beginning the journey here. Well,
Agree 100%. The journey is just beginning, but our goal, I know having spoken to Janice and the executive team in her company, we share this vision. We've been working on this relationship for over a year. We recently announced it, but it's been in the makings for a year, because we share so much of the same passion and vision of what the future holds. And the ability, what I love about their product is the ability to save a person's dignity and add a quality of life element to it. And we really saw that highlighted during COVID at its peak. If you're 80 years old and you started feeling symptoms of any sort, you were advised not to go see a doctor, because going to see a doctor during the peak of COVID could ultimately be more catastrophic and detrimental to you than whatever symptom you're feeling. Well, now we find out that a lot of people let, their symptoms go, and they unfortunately develop very serious illnesses and diseases. And so being able to, if this technology had been very much available 3, 4, 5 years ago, the outcomes would have been so different for a lot of these people. They would have been able to get diagnosed much earlier on. They wouldn't have had the fear and the anxiety of getting in a car and driving to see a medical professional. And I mean, the list just goes on and on.
Yeah, the isolation, so you think of like a chat, Wellbe chat, at least to have that, some people were just completely cut off. There was complete isolation. So, there's a lot of exciting stuff going on in this whole area with AI and health, healthcare and analytics and, patient, user interface and such. But listen, I want to really thank you guys for your time and come out of your busy schedule, because this is obviously an area that we're just beginning to dwell on. And we look forward to speaking to you in the future as things develop.
Thanks, Tom.
Absolutely.
Thank you, Tom. Much appreciated.
Yeah. So
Have a good weekend, everyone.
You too. So, once again, we're speaking with Janice Washleski, the Chief Commercial Sales and Marketing Officer at HandsFree Health, and Patrick Battaglia, who is the CEO of MetAlert, which is traded under the symbol MLRT. And this has been Tom Bustamante with Next Realm AI Tech Talk.